should I say student nurse case. So hi everyone, welcome back or welcome to my channel. My name is Casey. You are on Kaciecuse, which is my channel. Hello, welcome. Today I am going to be sharing with you my nursing school experience for my first year. If you guys didn't know this, I completed my first year of nursing school in May of this year. I started in August of last year and I'm approaching my second and final year of nursing school in just about a week. So I thought what better time than to reflect on the first year of nursing school and kind of fill you guys in and let you guys know what my experience was like and what you can expect if you're about to start nursing school yourself. I'm sorry, my hair is like insane today, so just don't mind that. I'm sorry for it. It's kind of Mufasa-like and crazy, and also the sun just keeps peeking in and out, and I'm using natural lighting and it's kind of weird and awkward, and I'm standing too for this video, so this is my little bulletin board. I made a little sign for you guys here, and I'm just, you know, here I am. I also have my stethoscope around my neck just to give it a little more of a nursey vibe and feel. Without further ado, let's go ahead and get into my experience, my first year in nursing school. So if you guys didn't watch my college experience video, I will leave it linked in the cards and down below. Basically, I will just sum it up by telling you guys that I am 25 years old and I graduated Syracuse University with my bachelor's in fine art photography in 2013, which is just over 3 years ago. And I did a whole video about my college experience going to SU and getting that degree, and I would love if you guys would go watch it after you watch this video. One of the first questions you might have for me is, what made you decide to go to nursing school after having a degree from Syracuse University? For starters, I began working at a hospital at the ripe age of 19. It was the first job that I ever had. I was working in the hospital as a patient safety representative. With that job came the duty of sitting in a patient's room, making sure that they're completely safe. I worked with people that would overdose on drugs, that had suicidal thoughts, older, dementia, Alzheimer's patients, intoxicated people, people that were just unsafe, very threatening and abrasive, and kind of just all of the like psych patients that came to the hospital. My job and my co-workers' jobs were to sit with them in the room. It's still a job that exists. It's still something that I kind of do, but we'll get into that later. Doing that job for as long as I did, and even just right off the bat, I got to see so much, and I got to see a lot, and I got to help the nurses as much as I was comfortable helping them, and I did see everything. I saw what nurses do, I saw what doctors do, I got to go to all the tests with the patients, x-rays, CAT scans, everything. I got to see a lot of things in the hospital from the get-go, right off the bat. That job is such a great experience. I suggest if you are interested in nursing at all and you're like still in high school, get some volunteer experience in at your local hospital, or try to find a job at the hospital that you can work at until you're in nursing school, because you will get so much exposure just working in the hospital as an employee, doing anything from something like my job to patient transport or pharmacy transport, stuff like that, stuff that's entry level. I suggest if you're not in nursing school yet, or you kind of want to see what nurses do, maybe you can shadow a nurse, all that good stuff. But working that job put the idea in my head that nursing could be something that I'd like to do down the road. My mother is a nurse, a licensed practical nurse, and she kind of always put the idea in my head that I should go to nursing school. Like, she always kind of was like, what about nursing school? What about nursing school? And of course I had it in my mind that I wanted to be a photographer, so I went on to Syracuse to do just that. But she got me the job at the hospital, and really, ever since I started that job, nursing kind of became a little bit of a focus for me, and as the years went on, it really became something that I wanted to strive for after I was done at SU. So while I was still a student at Syracuse, I went to the College of Nursing that I was going to apply for, which is the one that's associated with the hospital that I work at. I talked with them and I figured out what I needed to do while I was at SU in order to like get ahead and get accepted. But if you're returning back to school like I am, like after years of being out of high school, you have to kind of do a couple things before they accept you. So I needed to have my prereqs done. I had to have psychology, sociology, microbiology, and anatomy and physiology 1 and 2 done. I had to have those 5 classes done before they would even look at my application. So after I graduated SU, I had finished my psych class and I was starting to work on those prereqs little by little. I applied without realizing that I had to have all of those done. So I was working online, doing online classes to get those prereqs done, and I had A&P 1 done in microbiology, I think. I had A&P 1 in microbiology done, and I decided to just apply because I thought by the time I get accepted and I get into school, I'll have all those classes, the other 2 classes I'll have done. So I did that and I didn't get accepted, and I was devastated. I didn't understand why. I'm why wouldn't they accept me? I already have a degree. I'm working on these classes, yada yada yada, etc. And I went back to them and I was like, what the heck? What did I do wrong? They're like, you have to have these classes finished before you can apply to our program. So it took me another year to get those done. Between the time I graduated SU and started nursing school was a 2-year difference, and within those 2 years I completed the 4 classes that I needed to, and I reapplied. I think it was in the fall of 2014. Yes, I reapplied in the fall of 2014. I got my acceptance in February of 2015 to start school in August of 2015. So I was so enthralled when I finally got accepted. I was like, thank goodness. So last August I had my orientation for my first year of nursing school, and I was so excited to start. So the nursing program that I'm in is a 2-year program. I'm going to be getting my associate's degree by the end of next May. I will have that. And basically what you can do with that associate's degree is work as a graduate nurse in the hopes of you taking your NCLEX, which is the state boards here in New York, and I think other places. I don't want to sound dumb. I haven't done research on other states and how nursing programs are elsewhere, but I am in New York State, just to let you guys all know. And the NCLEX is the licensing exam that we have here. So after you become a graduate nurse, you can work in the hospital for a couple of months until you feel comfortable and have studied enough to take your boards. And after you take your boards, you become an RN, and then from there you have to get your bachelor's degree. And I luckily have lots of options for that after I'm done, but this is just me speaking about the program that I'm in now. If you guys have any questions about what I'm planning on doing, just leave them down below and I will be happy to answer them for you. So I started classes last August, like I said. I feel like all nursing programs are just a little bit different. Mine, the classes are taught, there's 2 different classes. You have your main topical class and then a lab class. And our main class, our main nursing class, is taught by a ton of different instructors, nurses. And in the lab skills lecture classes, you kind of go over what's going to be happening in your lab skills lab. I have no words to describe the things that I'm trying to describe to you. There's those 2 classes and then you have lab. And in the first semester, we kind of just learned all the basic stuff. Let's pause right there for just a second. You're all probably wondering what the heck I mean by all the basic stuff. What we learned in that first semester in lab are skills such as bed baths, getting vitals such as taking blood pressures, and getting people's temperatures. We learned about thermoregulation, oxygenation, heart rate, respiratory rate, pain assessment. We learned how to do a basic head-to-toe assessment, but we learned skills like urinary catheterization. We learned how to give finger sticks. We learned how to use different assistive devices to help ambulate our patients around, safe patient handling and movement, and all that good stuff, just to name a few things. And we did class and lab for about 2 weeks, and then we started clinical. So the first floor that I was on for clinical was a medical surgical floor. And basically, that floor gets all different kinds of patients, to be honest. So, for our first semester, every week before we went into our clinical setting, we had to do a processing guide. I'm sure there's tons of schools, nursing schools around the country that do something very similar, where you kind of look up the patient that you're going to be taking care of and you get all of the information you possibly can onto this really long, ours is like a 9-page guide, and you kind of look up their condition and all the surgeries that they've had, if they've had any, their background, and you kind of apply your pathophysiology to whatever their diagnosis is, and you have to do all this work before you go into the patient's room and all of that good stuff. So you have to have all of that done before you can be allowed to go on the floor for clinical. We also had to meet our patients every evening before clinical. We had to go introduce ourselves, let them know that we would be taking care of them the next day, and just kind of let them get a familiarity and know a face is coming in, and let them know that you are a student nurse and you're learning, and if they had a problem with a student being assigned to them, they could let the staff know and then go from there. Going into clinical the first time, first day, all we really were doing is bed baths, and that's about it, and helping each other out. My clinical group consisted of about, I want to say 8 people. I don't remember exactly, it was already a year ago, and so much has happened since, but my clinical instructor I actually knew prior to clinical, and he's a nurse that worked in the emergency department at the hospital, and like I've told you, I worked as an employee of the hospital, all around the hospital, and he knew me from my previous job. So he was like, you know a lot, you were a patient safety representative, you have a clinical background, I'm putting you by yourself. So everyone else in my clinical group had a buddy to tackle the day with, and they all shared a patient, and I had to do it all on my own, and he kind of singled me out and put me in this other category that I didn't really belong in. Yeah, I had some clinical experience and comfortability and familiarity with the hospital and the staff, but from the nursing standpoint, I really did not, and I do at that time, I did not have any really confidence in myself to do it on my own, and I was really scared going in my first day all by myself, knowing that everyone else had someone there, So I was by myself, and I kind of took it as an honor, but also kind of it just made it a little bit harder on me. So long story short, first day of clinical, just were bed baths and nothing fancy. I could handle that. I literally have smelled every smell that there is as a PSR, and now as a student nurse, there's a whole other world of smells that I've gotten to experience. But that was no big deal to me. I'm a pro, definite pro at bed baths. I have no problem cleaning anyone up in any situation. I can do it by myself, even patients that are hard to turn, I can do it because I've had to before. So anyways, got to do all that dirty work the first couple of weeks, and then maybe the second or third week we learned how to take vitals. So I remember the lab for vitals, I actually had a hard time doing blood pressures. I don't know what it was. My nerves really got the best of me, and I almost wasn't able to get out of lab. Oh, I have to backtrack. For all of our labs, we have a test out where we have to practice the skill in the lab and then test out. Otherwise, we cannot perform that skill on clinical until we can do it in the lab perfectly. So I was having a little bit of trouble with blood pressure, and I almost wasn't able to test out, but eventually I got it and I got out of there smooth sailing, and now obviously taking a manual blood pressure is no sweat off my back. But I remember how nervous I was and how difficult of a time that I had. So just know that if you're struggling with a skill in nursing school, that you just need to take a deep breath and know that you're gonna get it. And once you do and practice it over and over again, it's like with anything in life, it'll just become second nature, and you just aren't scared to do it anymore, and you just do it. And that's kind of one piece of advice I have for you in nursing school, is you just have to do it. You can't be scared. Try to get over that mental anxiety and just do things, because If you hold yourself back because you're scared, you're not going to be able to learn it as effectively. And I've found out that when I just let go and just do something and not overthink it, I get done with it so much faster and with so much less stress. So that's my biggest advice, is if you can get over that hurdle, mental hurdles, all that good stuff, you will succeed faster and it'll be a lot more stress-free if you can find ways to overcome your anxiety. Clinicals were a-okay. I was able to perform all the skills from lab in clinical and pass them a-okay. My instructor was amazing. Even though he singled me out in the beginning, he really nurtured us as like student nurses in our first clinical, and he did an amazing job at letting the nursing staff know that we were babies, and he treated us just very carefully and taught us a lot and challenged us in ways that we could handle. And I just appreciate that clinical experience so much. All the while that we're having clinical, we're also having classes along the way here. So not only do we have to do these big long processing guides, but we have to study our butts off for these tests. Nursing school, or in my program anyway, tests are very frequent and they were hard. My nursing school does not take it easy. All of the questions on all of our tests are NCLEX questions. They're not baby questions. They're not like we're going to start you off easy and the tests are going to get harder. Right off the bat, you're hit hard with these very high level, and we were given level 1, curriculum and like questions, but they're from the actual NCLEX, like all of the questions. That type of, select all and apply, the tricky wording, we got used to that right off the bat, because being challenged like that and making it really, really hard just to pass nursing school is making me feel so much better about taking the NCLEX in another year. Like I don't feel ready to take it yet, but I feel good about where I'll be by the time I'm ready to take it, if that makes any sense. For me, I found that my old study habits that I kind of had at SU and like in high school weren't working for me. I was freaking out the first couple of months of school. I kind of had like a mental breakdown in October, which is kind of when clinical started to get a little more challenging, and the test, I got a few of my test results back and I was not doing as good as I wanted to be doing. But just know this, if you're in nursing school and you're just passing and just making it by the skin of your teeth, that's okay. I feel like you learn a lot more when you are able to experience things in nursing. So tests aren't always a good indicator of your knowledge. I mean, they are in some sense, but I feel like clinically and like the clinical skills that you develop, those skills are a lot more useful in the future. I don't know. But anyway, my anxiety started to escalate a lot in October of last year. And also, I just want to throw this out there real quickly if you guys are interested. I've been a daily vlogger for the past 3 years, ever since I graduated at SU. So you can go back to about a year ago and watch like me in nursing school through my vlogs. I talk about it a lot, so that might be a little more helpful than me like recalling what happened a year ago. Just throwing that out there. So if you want to go check out like my vlogs in real time, like as all this was happening, you can go check those out. The reason I think my anxiety was escalating was I wasn't preparing myself enough for my tests and I was feeling overwhelmed by the material. So my best advice for you to study is to definitely break down all of that material. Even though it might pain you to do it, every day after class, just condense your notes and try to figure out what were the key points and kind of separate them from everything else, because the key points and the things that your professor stressed the most are probably what are going to be on your test. So kind of go back through your notes, take all the big bullet points and put them somewhere else so that you're not distracted by all this other stuff. And what I found with my schooling is that I don't really read the texts that are assigned, or the readings that are assigned to us each week. I much prefer kind of browsing the objectives that they give us and then looking over the PowerPoints that we're going to be doing in class. My classes are all PowerPoints. Every single instructor does PowerPoints, and we sit and lecture for hours listening to them lecture us on what is on the PowerPoints. So the PowerPoints, how many times can I say PowerPoints, are what I use to study. And then I kind of, after I've taken all of those stressed ideas from my notes, I kind of go in the readings and try to find a little bit more information, a little bit more understanding on those topics, so that when I go into the test, I'll have a good, cushion of knowledge to make the best decision on my answers. So that's a little tidbit I have for you for studying, and also taking practice questions has helped me immensely. My school has a bunch of online tools where it generates like tests for you. I'm sure that that's an option at many other schools. You have these built-in computer programs that are just really good at giving you test-like NCLEX questions that are very difficult as the test will be, and they really help you prepare for the test. Oh, speaking of, this stethoscope I purchased myself off of Amazon. It is a Littmann quality. It's just one of the basic Littmann stethoscopes. It's not too fancy. It has, the diaphragm and the bell, all that good stuff. It clicks back and forth just like any good old stethoscope does. And it's orange. I picked out this color because orange is my favorite color. And they have like every color. Wearing your stethoscope around your neck is frowned upon because the patient could choke you if they were dangerous or whatnot. But, sometimes you just have to throw it up there, and I just have mine on there for the sake of this video. I hope it's not bothering anyone. Taking the first couple of tests, I was really nervous that I was going to get any better grades on the test. I was thinking that I was just going to be an average student and not excel at all, which actually has become the case. I am not like the most phenomenal nursing student ever, like as far as grades go. I feel like my bedside manner and my clinical skills are far beyond like my testing knowledge. My new clinical floor was a cardiac floor, and it is actually the floor that my mom works on. I was so excited to start clinical there, and we started to get, to do more invasive things with patients. We got to learn how to pass PO meds, so that was super exciting. And then the week after that, we started doing sub-Q injections. I loved the cardiac floor, like I said. I was so successful after my time on the cardiac floor. So by the end of the first semester, we learned an array of clinical skills, and we had to do like a clinical skills practical. So for my lab practical, I randomly chose to do Foley, insertion, and removal. So for my practical, I had to insert a Foley and take it out, and I was so nervous. I literally, because of the whole sterile technique, you have to be very, very, very careful, and even in just the practical setting in our sim labs, you have to do it perfectly, otherwise you can't pass lab practical. I would have failed my lab class if I didn't do it correctly. So I got through inserting the catheter completely fine, clean, perfect, and everything, and then the next step was just to DC the catheter and take it out. So I was pulling back, getting all the water out of the balloon, and for some reason and again, you can go watch my vlogs because I vlogged the whole semester last year, so you can literally see like in real, see what I was doing and how I was feeling and all of those moments and all the things that I was stressing out about, specifically individualized in my vlogs. So anyway, my first semester in nursing school was basically just like a med-surg course. Didn't learn anything really specifically. I did, however, one week we had to do an elderly experience, and I got to travel to a senior living home, and it was quite the experience. I love old people, and luckily the environment that I went into wasn't like they weren't patients. They were members of this like club, and they all go there. It's like a day program for senior citizens, and they were just amazing, adorable, welcoming. I loved going there and just spending the day with some old people. It's fun. Throughout the semester, we got to do like outside experiences. So my first semester, that was our main outside experience, and I enjoyed it. So I passed my first semester of nursing school, absolutely a-okay, made it through, still breathing, still alive, and I was moving on to my second semester. And I also succeeded in clinical, passed clinical, got all the checkpoints that I needed to move on to my second semester. So while I was doing this first semester of nursing school, I was also still working as a PSR in the hospital. So that's kind of why I'm not able to like really push my grades up any higher, is because I have so much going on in my life other than school, which is crazy to think. A lot of my peers are in college as well, like they're just students and that's all they're doing is nursing, where I'm in a different predicament where I have to be working and doing school, and I care so much about my family that they envelop a lot of my time as well. So luckily, I mean, not that it's a lucky thing, but I don't have like any kids or anything. That would be a whole other story. And moms that go back to nursing school, I applaud you. I don't know how I would do it if I had kids or even if I had a dog. Knowing that was the end of my first semester in nursing school. And with the end of my first semester in nursing school came the end of my job as a PSR, which I worked for 5.5 years. And I transitioned into a job as a student nursing assistant at the hospital. As a student nursing assistant, basically you get a bedside assignment. So you get an assignment and you kind of just do like bedside care. So all the skills that we've learned in clinical, except for passing medications and doing all of that kind of stuff, we didn't do that. We don't get to do that as a student nursing assistant. We just get to do like daily care, kind of stuff like that. So I was really excited to get to do that job in the hospital and transition into something that has more but more responsibility. I'm still doing it right now. I absolutely love it. If your school that you're going to has a program or a job opening where you can be like a CNA or an SNA, a student nursing assistant, definitely apply for it, because you get so much experience. You get to kind of get a feel for all of the floors in your hospital. I never really realized, working as a patient safety representative, the vast difference in the patient population of each floor and how each floor kind of works. I highly suggest, working in the hospital while you're a student nurse. It's very beneficial. I love it. So anyway, I started doing that, and in January we went back to school for our second semester, and I started out the semester in the family health. My second semester was split in half. The first half was family health and the second half was med surg again, like the level 2 med surg. So the family health portion of my second semester consisted of pediatrics and labor and delivery and maternity. What is the word that I'm trying to look for? It was like OB and peds. And our clinicals were broken up into like chunks. It was a lot harder than med surg for sure. But basically how clinicals were working for the family health, where we got to go to a pediatric floor 1 week. So we had 2 days of clinical on a pediatric floor, which I found that I don't really like. Hate seeing sick kids. I can't handle it. People that do pediatric nursing are, a certain type of nurse and a certain type of person, and I just don't think that I'm capable of doing that. I applaud anyone that does that kind of nursing. It's hard enough taking care of sick people, wonderful people that are sick, but at least they're in most cases adults, and have lived long lives, and that's kind of why I like old people, like taking care of old people, because they've had such a long life and they can tell you so much about their lives, and they might have like a lot of different conditions that you can like look into, and with these sick kids it's just heartbreaking. So I didn't really enjoy my time on the pediatric floor. It was a beautiful hospital that I got to go to though, all brand new. Wonderful place for sick children to go to if they're going to be sick and have to be in the hospital. But I don't know. I can't do it. I gotta say that. At least I had that experience. and I know I don't really like it. And the following week, I was on the labor and delivery floor. It was very exciting. On the first day, again, we were there for 2 days on the labor and delivery floor, and I got to see a C-section on my first day. She randomly picked 2 of us, and I was one of them, and I was super excited about it, and I was super fascinated by it. Like, I had, at that point, never seen a surgery before, so it was enthralling. Like, if you've ever seen a C-section, or if you've had a C-section, I hope that I never have to have a C-section. They just like rip you open. During the C-section that I got to watch, we had to do a newborn assessment after the patient delivered the baby. Me and my other classmate had to do a newborn assessment. We had to like clean the baby off and do the APGAR score. And one of the things that I got to do that we learned in our skills lab was subcutaneous injections, and I got to give the baby its first shot ever, which is a vitamin K injection into its heel of the baby's foot. But it was really cool. I like enjoyed the setting of the, you know, the operating room of a cesarean section, and my patient was a very interesting case, and I just enjoyed the whole thing. I had a really fun time on that first day of clinical. And then the second day I was taking care of a patient that was going to be having a vaginal natural birth, but she didn't end up having it during my clinical time, so I didn't get to see a natural birth, but you know, I might get to this next semester. So I really did enjoy labor and delivery. From a nursing standpoint, however, I don't know if I'd want to be a labor and delivery nurse. It's still kind of like floating around in my head that maybe I do, but you know, it's a happy time, but it's also very stressful and just a very different type of nursing than regular medical, surgical, cardiac, all that kind of nursing, like in the main hospital. I won't hate on it. I'm not hating on peds either. I just, from my experience, don't think that that's the type of nursing I'll be doing. But so I got to do that, and then the following week I got to go to the mother and baby floor, so like after, you know, the postpartum floor. So it's a lot, the nursing aspect of it isn't that involved, but you get to hold babies all day. I mean, at least we got to, and it was fun, you know, just to see these growing families get to, you know, have their baby and get sent home, and it's just a quick turnover, but it was cool to work up there, and I learned a lot. My instructor was the bomb. She was like the absolute best. So we were on that floor again for 2 days, and then we moved on. And during this time we were still doing processing guides, but they weren't quite as intense and invasive as our med-surg processing guides. Just kind of had to do like a little bit of a write-up after clinical, so there was that. After our kind of hospital setting for 3 weeks, we moved into more of like an outside experience for another 3 weeks. Got to go to a school, which was a very interesting thing. We just went there for like 4 hours and kind of observed. We didn't like participate. So these outside experiences are kind of just like observation based. They're not practice based. And then we also got to go to like a daycare setting, which really didn't have much to do with like nursing as much as it did with like development, which was part of the family health course. One of our last like outside experiences in family health was going to like the family practice office facility at the hospital, and we were there for 2 days, and it's basically just like a doctor's office. And during that time, I remember I got to give a subcutaneous injection, and it was a MMR shot. So I gave someone a vaccination, and I was so scared. Like, learning those skills in lab is nothing compared to actually having a human in front of you with a needle that you're, you know, about to shoot them up with. And my hands were sweating. My instructor at the time was very calm about it. She was like, "You did fantastic." And this poor girl, I did it, and I got it over with, and we moved on. It's kind of how it is with like clinical skills. They're so nerve-wracking the first time you do them, and you're like shaking and like scared, but after your instructor sees you and gives you the go on doing it by yourself, or, you know, doing it again with their permission, it is like a weight lifts off your shoulders. So yeah, I got to do that during family health. The lab skills that we learned in family health were pediatric assessment, bubble he assessment, which is the assessment that you do on a mother after she's given birth. We did infant newborn assessment, which is very scary. The tests, there's only 3 tests. We had 2 regular tests and then a final. I didn't do good on the first test. I was freaking out, so I had to do good on the second test and the final, and I luckily did, and I made it past family health. A-okay again, just, getting through it. After a difficult half semester of family health, I was so ready to just go back into med-surg and back into the hospital doing clinical on the floors that I had become so familiar with. I started off med-surg with flying colors. I did really well on the first test. Tests in med-surg were so much easier, and I, at this point, had developed my technique to study, so I wasn't freaking out for every test. I felt much calmer. My anxiety started to subside, and my second clinical of my second semester was on an orthopedic floor, which is not my favorite. Again, I kind of know what I like, especially now after I've been working in the hospital. So ortho, by the time we were on the ortho floor, we had learned how to give IM injections, so we were giving those. We were also able to hang IV mini bags, so I got to do that a couple of times. And at this point, we were basically getting to do everything for the patient, passing all the meds, giving all of their shots, insulin, like a total care, primary care sort of thing. All of the patients pretty much had some kind of broken bone or had to have some kind of surgery, a lot of back surgery, a lot of people getting back surgery, a lot of broken hips, a lot of, people that have fallen, a lot of elderly people that took a tumble but were otherwise healthy, So I enjoyed the patients themselves, but I don't know if I really like orthopedics. But during my time on clinical for that second round of clinicals, I got to go to an outside experience, but it wasn't really outside. I got to go to the OR and watch open heart surgery, but honest to God, I was in there for 6 hours, I want to say, maybe 7 hours in the total garb watching this open heart surgery, and I couldn't see anything. I couldn't get close enough to see the chest, and the chest wall was, they just had the tents over it and I could barely see it. And one of the surgeons called me over at one point to look in, but I literally I couldn't see anything. So I was miserable in my OR experience. I had to wear the mask all day, and at the end of the day, I took off the mask and I had a rash all over my face. I was actually working later that evening, after clinical was over, and I had to go to the ER. It was stupid. I really just wanted to go home and take some Benadryl and make my face rash go away, but I had to go to the ER and then get sent home because I had a severe rash on my face from wearing the surgical mask for 8 hours. I hated it. I will not be an OR nurse. I'm sorry, but I absolutely hated it. And the next day I had to go to an outpatient 1-day surgery center, and I liked that a little bit more, but still hated it. I just don't like the OR. I don't like that kind of nursing. I've learned so quickly what I like and what I don't. Yeah, med-surg was going by great. Class was a lot smoother than it was in family health. Clinical was amazing. I felt like a champ. I just loved it. I love passing meds and doing as much as I possibly can for a patient. At this point, the only thing that we aren't really doing is IV pushes and hanging main fluid primary bags. I loved doing all of the skills, and I can't wait to continue doing more of them. And then the end of the semester came and I had to do another lab practical. I passed all my tests. I did great in clinical, passed clinical with flying colors, and I had to do the lab practical. And each lab practical at the end of the semester can be any skill that we've learned throughout the year, and I pulled pediatric assessment. It was so easy. I had one med math calculation, and I just had to do the assessment and I was done. Way less stressful than doing the urinary catheterization my first semester, And I was just so happy to have passed family health, to have passed med-surg, to have completed my first year of nursing school with success, especially knowing how many people had to retake both courses. I just was so happy to be done with it. And of course, in that second semester, we had lengthy process guides with medications that we had to look up, and just it was more invasive and more intensive, more information that we had to put in to our studies. So it was just a lot. It feels so good after finishing my first year. I am apprehensive for my second year, but I'm excited to start. I'm excited to start in another week. I just want to kill the second year and last year of nursing school so that I can graduate and become an RN next summer. This time next year I should be an RN. Cross your fingers. I'm pretty sure I will be fine, but I'm just excited. That's all I can say. I can't believe I finished half of nursing school and I'm moving on to the second half. It's just mind-blowing. If you know how long of a journey I've been on, and if you go back and watch my vlogs, you will know, all the things that have happened that have led me up to this point. But I hope that this has answered and covered a lot of ground for you as far as nursing school goes and how it feels. I hope it wasn't too scatterbrained and too all over the place. I hope it was concise, made sense. I know that I can be quite a rambler and I talk a little bit too much about certain things, but I hope you guys enjoyed this video. I hope it answered any questions you have about nursing school or any suspicions or worries that you have. Please leave any comments down below regarding your feelings toward nursing school. If you're going to nursing school, any questions, concerns, or comments that you have, let me know down below or contact me any way you would like to. I would love to help you guys out in any way that I can. Look forward to more nursing school videos. I am going to be doing a back to school supplies haul, how I stay organized, because you definitely need to stay organized in nursing school, otherwise you're going to drown. Make sure you subscribe so that you can watch my vlogs in real time of me in nursing school. I vlog every day and kind of just check in about how I'm feeling and what I'm doing, so those are always helpful as well. So thank you guys so much for watching this video. If you liked it, please give it a thumbs up. And you know what to do. Subscribe to my channel for more videos like this from me, and I will see you all on another time. Bye everyone! If you're going back to school, good luck and have fun. I'm losing it. I don't even know what I'm saying anymore. Blah, I'm talking so slow. So much to say. I don't know how to can do this in a concise manner. Oh my god. Oh Lord. Why does she want me to be in her group? Now up at SU, Greek life is huge, and my freshman year I didn't really understand it at all. Back in 2000